emergency is a thought that never should have been there, and it's a thought of the past, if at all it was there. I always tell everyone there's no vaccine for the stupid. If you can vaccinate your children and you can vaccinate your pets, why do you think about yourself and your children then? I mean, yourself. So you must go ahead and vaccinate yourself. What do you do before you go to before you take a vaccine, and who are eligible at this moment? From 1st May, everyone above 18 is going to be eligible. I don't know the logistics, how it's going to pan out, but it sounds very, very difficult that they get en masse people at vaccine centers. So of course, you go into the app, please book an appointment from the side of the government without having direct interaction with the union government. I urge everyone to book an appointment and don't walk in at vaccine centers. I do not want this whole process of vaccination to actually turn out to be a super spreader event. Now that we're going to start vaccinating younger people, 65 to 70% of the younger people are asymptomatic, are mildly symptomatic, and they will just ignore their symptoms. I don't want them to land up there and infecting others. The truth about Mr. Agrawal, that if you go and take a vaccine, you turn out to be positive, I think there's no truth. The truth is that you do get infected because you have COVID inappropriate behavior. You go there, take your vaccine, put your mask down, drink your water, take that paracetamol given by the vaccinator or the vaccine nurse, start eating a biscuit, start taking selfies with your mask down, start hugging each other. This is our fault. This is inappropriate behavior. It's carelessness, COVID inappropriate behavior that is causing this. Now, what do you do before you? Yeah. Sure.
Sorry. I just wanted to add one more perspective. You know, there were questions with people with comorbidities, right? I mean, diabetes, clot on the lung, using blood thinners currently. Any views on are there any circumstances under which we should not take a vaccine?
So there is no contraindication to a vaccine. The only real contraindication at this moment is if you've had an allergy prior to this vaccine. And, you know, most of us are going to take their first jab. I don't think we've had an allergy. These vaccines do not have preservatives. So if you're allergic to sulfa, penicillin, you needn't worry. They do not have any of these drugs. It is completely safe to have your vaccine, even if you're immunocompromised, if you're a cancer survivor, if you're ongoing therapy of cancer, if you have diabetes, if you have high blood pressure. On the contrary, you are at a higher risk of developing severe COVID infection. What is the real contraindication besides, anaphylaxis or besides allergy? If you have very low platelets for whatever reason, that doesn't mean you go and check your platelets tomorrow. But if you've got a disease where your platelets are low, you need to be careful because you can get some bleeding. But this needle is so thin, it's an insulin-sized syringe and needle. It doesn't hurt. You be careful. If you had thrombosis in the past, so for whatever reason, if you've had a history of thrombosis, you need to be more careful. Then I would suggest you may decide to go for the Covaxin than the Covishield. Not to say that Covishield causes thrombosis. There is absolutely no direct relationship. So, Mr. Agrawal, these are all safe for everyone.
Okay. And any view on between the two, if one had to pick?
So, which one of the two would you pick? I would pick the one that's available. So they are equally efficacious, equally safe. So go for the one that's available. Don't wait for this one and don't travel to that point to get that one. I would say just go. They're absolutely safe.
Sure. And in fact, I'm already seeing comments, people saying that I've heard that vaccine reduces immunity and we are prone to have COVID if that happens.
What is the chance of you getting COVID at this moment of time where there are so many Indians getting COVID? It's so high. I can assure you and tell you from data, from what I see on ground, that people who had 2 shots and 15 days post their 2 shots, even if they caught COVID, it's a much milder variant. I think the chance of getting COVID and getting into some form of morbidity and mortality is so much higher, almost 100 times higher. I have not heard of people dying of COVID after taking 2 shots and 15 days at this moment.
Okay. What about gap? Given all the struggles with vaccine availability, I mean, minimum, maximum gap between the 2 jabs?
So this has a parliamentary view and a non-parliamentary view, or my view. I would go to my view here. I don't know what the government advises. I mean, I don't want to say what the government advises. My direct view is 4 weeks. I see no reason to wait for 8 to 12 weeks between the 2 shots. I mean, the first jab gives you some immune response that starts 15 days later. And the second jab after 4 weeks give you gives you a secondary immune response, which brings your antibodies much to a higher level immediately. So I don't understand the logic at this moment of time. We may come out with data 6 months down. Why should you wait for 8 to 12 weeks?
Okay. And the other question, of course, a lot of people has, if so I've had COVID, or maybe I'm asymptomatic and I don't know, should I take the shot? Should I take an antibody shot before, to figure out when do I take the vaccine?
So if you've had COVID or you're suffering from active COVID, you need to wait for 15 days until your COVID period is over, and then you're safe to go and take the shot. If you've had COVID in the past, again, what I've seen from random reports is that the antibody levels start declining after 3 to 4 months. So if you've had COVID in the past, you still need to go and take that vaccine, irrespective of when you had it. But do wait for 15 days after your COVID infection is over.
And a lot of people, of course, had reactions to the first shot. I mean, even I myself had fever, etc. All of that. What scientifically, what does that actually mean?
It just means that this vaccine has the correct contents. It doesn't mean that if you've got more side effects, you get a better immune response. No. I mean, as kids and as adults, even today, if you go and take the flu shot, for that 24 to 36 hours, we do get a little lightheadedness. We do get a little chill. We may get a little body ache. So it's just a normal immune response. It does not convey or result into better immunity or ineffectiveness or effectiveness.
Okay. But what if I don't know I have COVID? I mean, maybe I'm, should I be doing an antibody test, or I just go for it?
Mr. Agarwal, doing an antibody test, one, besides the cost, explaining the patient the interpretation is such a havoc, because they'll do one kind of antibody and then they say, doc, this antibody is this and this was that, so you don't need to do your antibody test. I would suggest to do an antibody test when we have shortage of vaccines. So the people who had COVID first, they may take the first shot and then they may wait for a second shot if they have an adequate antibody response.
Okay. I mean, of course, it's early days, but how long are we immune with sort of having a vaccine? Is there any data around that?
No, there's no data, but my guess is 6 to 9 months, at least 6 months. I would stretch it to 9 months. The flu vaccine also works for 12 months. I recommend people at high risk to take it every 10 months. So it's like any other virus. I would recommend at least 6 to 9 months that you may not require a booster shot.
Okay. And my last question on it is, so I've done 2 jabs, I can sort of mask off and now party, or what is your recommendation?
Your last question had my first answer had your last question. The 2 vaccines after 15 days does not prevent you from getting COVID infection. It prevents you from getting severe COVID infection. So if you've taken 2 shots and you get your mask off, not only do you have a risk of getting infected, you're at a higher risk of infecting those people who've not got inoculated. So please, COVIDian behavior is the first thing that we have to do. Masks above your nose and below your chin, not like your jeans below your waist. Wash your hands with soap and water or an alcohol-based detergent, and keep a physical distance as much as possible.
Okay. And again, lots of questions coming as we speak about, which between the 2 for younger kids, for elder people. What I'm hearing from you is that it just doesn't matter. Take what you can get.
It just doesn't matter whether you're 16 or 96. It doesn't matter. Just take what you get. Both are safe.
Okay. Let's move on to sort of one more topic, and we'll come back if people have questions on vaccines. I want to just talk about sort of protecting or safeguarding myself against COVID. One is, of course, COVID behavior, and this is not, this is something that can happen. But what are some of the simple tips that any household can do? What are those 5 things that every house should today have, from an immunity boosting perspective? There are questions around, should we all mask up at home now, given that this new airborne theory is around? What's the general view there?
So this little theory about airborne disease, I don't regard it, but I don't disrespect it. So the little theory that's put up from the Lancet is that in hotels, they have found, guests staying in, suppose A guest was staying on floor 3 and B guest was staying on floor 9 or floor 4, and A guest had COVID. Guest A and guest B never met, they never interacted, but yet guest B got positive, and this was after incubation, 14 days. There have also been reports to say that in hospital settings where you had COVID specified areas, they found PCR swabs positive in non-COVID specific areas. So to say that there could be a possibility of airborne disease or airborne transmission. I don't buy that, because then entire hospital staffs, entire COVID centers would have got infected. I don't buy that completely, but I would not disregard it, as I said. What are the 5 things that you do? So one thing about immunity, and I'm going to cover your entire immunity, whether vitamin C, zinc, vitamin D, your haldi, jeera, whatever you have at home helps you fight COVID-19. It builds up your immunity, yes. It does not prevent you from COVID-19. Drinking water with any of your homemade ingredients or having vitamin C will not boost your immune response immediately. For an immune response to boost up, it takes years to go up. So good advocacy of health in terms of good eating, regular exercises are the best ways to improve your immune system. What else you do? I think the first thing that you should do when you come back from home is go to the bathroom, remove your mask there rather than removing it anywhere else. Trash it in a safe place or a safe box or a safe bin or a safe bag. Wash your hands with soap and water for at least 20 seconds. Now, I know some smart person from your ABC consultancy is going to say, I'm not going to carry a watch for 20 seconds. If that's not possible, sing to yourself happy birthday twice, and that would mean 20 seconds. If you sing to a happy birthday, that means 20 seconds. The other thing you do is also clean your feet. Keep your clothes for washing and keep it, don't reuse them, don't rewear them. It's best to keep them here, give it for washing. If you have help that's coming from outside, it's a good idea to test the help before they join you if they're working 24 hours for you. If not, it's a great idea that when that help comes home, you make sure that he or she keeps the mask on until they leave. And it's also a good idea that you don't have a direct interaction with them. And if you have to, try to keep a distance of about 6 feet or 2 meters from them as far as possible. Other people say that I've had COVID in the past. So my staff has had COVID in the past. So it's damn safe to get them. Yes, it's very safe for that person, because that person is not going to get COVID, but that person can be a carrier for you. So that doesn't mean that someone who's got COVID is safe. Yes, it's safer than someone who's not got COVID, because the risk of getting infection is high. And then the risk of transmissibility is higher, but that doesn't amount into your safety completely. So COVIDian behavior is the only way that you can keep yourself safe. Do not party, do not meet your friends, do not hug and kiss each other outside if you don't know them. If it's your family, it's good enough. And don't go for rallies, don't go for all outings. I mean, avoid this socializing at the moment. If you have to go to someone, for example, if you're staying away from a parents or your brother or a sister, and you have to meet them, make sure you call them before you go and find out the general smell of the house. The staff is okay, no one's suffering from cold, cough, fever, etc., and then go there.
And things like, I mean, a lot of us have become almost now OCD on, just cleaning surfaces all the time at home, steam, gargle. How much of this is really useful?
So formite transmission is what you're asking, that, you can spread COVID from formites, that's surfaces. Well, formite transmission is a possibility. For example, if I sneeze in my food and if I have COVID, or I cough on the plate or the table and if I have COVID, and then someone comes and touches it and snugs it on their nose, that's a possibility. How rare is that? It's not so common. So I would say be careful, but don't cough and sneeze. So every time when I say, if you have to sneeze, don't say excuse me, say elbow please. So if you don't have a handkerchief, use your elbow like this and then sneeze in it. That will prevent dissemination. Each cough transmits 40,000 droplets. That's a lot of viruses or droplets. And each one droplet has 13 to 14 nuclei for virus or a bacteria if you're infected. So that's a lot of load. So be careful, don't do that. What about steam and gargling? Everyone's doing it for a year and a half. Haven't yet all of us or all of y'all been infected. So one thing about steaming and gargling is great. It'll also keep your dental hygiene well, and it'll keep your mental sanity well. Steaming, be careful you don't burn your oropharynx and your throat if it's very hot. If it gives you a make good feeling, use it. But the steam, if it remains at that temperature more than 100 degrees, you'll burn yourself. Obviously, it'll come down to your body temperature. So I don't think it offers complete protection.
Okay. And masking. One is masking at home specifically, now especially, I see a lot of people talking about doing that. And broadly, the issue around masks the other day, now the new theory is cloth masks are bad, and suddenly everyone's scrambling around. Any views on that?
I think if your family members are safe, as in they don't interact with too many people outside, or they're at home bound and working from home, I don't find a necessity to mask yourself at home. But yes, if you're going out working, for example, our healthcare workers, it may be important for us to keep a distance from the family members who are not going out. What about masks? So we have three types of masks. One is a cloth mask, the other is a surgical mask, the green color or the white color mask. Typically there you get, that's a tri-layered or a three-ply or a three-layered mask. And the third one is an N95 mask. The N95 mask is only for healthcare workers and doctors and staffs. It's not for the common person. So please don't go and buy and hoard N95 masks. Fortunately, we're not at a shortage that we were a year ago, but still don't use them. What about the three-ply mask? So three-ply mask is about 12 to 13 times better than the cloth mask. But if you have no interaction with the COVID patient, if you're not entering any area where you're meeting a COVID patient, I think a cloth mask is good enough. So you must use at least a cloth mask, if not a three-ply mask. The cloth mask should be come home and washed, just dried, use a detergent if you have to, wash it with water and dry it. It's good not to use it again. A three-ply mask is actually better, but it has to be disposed every time you use it. So you can't keep using a mask. The problem that I also face, Mr. Shiv, with three-ply masks is people just keep rubbing it down like this. And then they soil their masks, they tear it, and they dirty it. So that's one thing that you should do. There's also a method to wear the three-ply mask. So if you have a three-ply mask and you don't knot it, that means you just wear it like that. It gives you about 56% protection. A cloth mask gives you about 51% protection for small viruses. If you knot your surgical mask, that means you crisscross before you put them at the back, that firmly grasps the contour of your face, it gives you a protection of 77%. And then if you're going to a more active place where you're likely to meet more people, you can wear a cloth mask and a surgical mask that gives you an 85% protection. And N95, needless to say, we wouldn't have survived till now as healthcare workers, gives you 95 to 99% protection.
Okay. Doc, we have a lot of young parents also here, and there were questions around, besides the usual vitamin C, etc., that all of us have. What should we do for young kids, let's say sub 10 years old, to boost their immunity?
Get them into a regime that they exercise for 15 to 20 minutes. Give them good nutritious food. Don't give them pastas, pizzas, and fries. Give them some green vegetables. Give them fruits. Vitamin C, you have one orange, that's enough of the RD or the required daily amount required for daily usage of vitamin C. You don't need to take a vitamin C tablet. So I would suggest you don't need any extra supplement if your kid is eating well and healthy.
Okay. Let's talk a little bit about testing, Doc, right? So one question that came up quite a few times is, how do we distinguish between COVID and just a regular seasonal allergy or flu? I mean, can both happen together, or should one be worried?
So both can't happen together. So how do you differentiate? Well, there are no classical signs to differentiate, but I can tell you both have fever, both have cough, both have stuffy nose. The sense of smell and taste is more often lost with COVID-19 than common flu or influenza. Body ache, especially backache and leg pain, is equally common, but headaches is more common with flu. If you have an allergy, or if you have a history of getting common flus at seasonal changes, typically this time and before the rains, then you're more likely to get this. If you've been exposed to someone with COVID-19, there's a higher chance you've got COVID-19. So there's really no definitive way clinically to say you've got either flu or COVID-19. So you can test yourself then. What are the modalities of testing that we have? We have basically three modalities, and I will just go ahead and jump into all three. One is a rapid antigen test. The second is the PCR test. And the third is the CT scan test. Please leave the CT scan for the healthcare worker, the doctor, to decide when you have to do it. The rapid antigen test is a specific test, but it's not a sensitive test. So if you've got acute symptoms of COVID, then the chance or probability of getting a positive rapid antigen is about 40 to 60% at most. But if you have a rapid antigen that's come positive, you have COVID-19, point blank. A PCR test is a very specific and a very sensitive test. So that's the gold standard test. So if you have a PCR test that's positive, you are positive. You can't say, but doc, I had fever 3 days ago and I'm asymptomatic, and go into lab B and do another test and say this has come negative. No, the sensitivity is about 65%. So you may get a false negative, but there is nothing like a false positive. There is something called as the CT value, cycle threshold value. I'll tell you 30 seconds about it. A cycle threshold value gives you the rate at which the virus multiplies. So it gives you infectivity score. It does not give you severity score. So if you come and tell me I have a CT value of 18, that means am I very serious? Listen, it does not tell me how severe you'll get. Your symptoms will tell me how severe you'll get. It just means that you are more infectious. Any value above 35 should be disregarded. That means you don't have COVID. Okay. Now the CT scan. People often do a CT scan on their own and then on their advice. If you have a high suspicion of COVID and you're 4 days down COVID-19 symptoms, then a CT is a good test to do. A CT is not a great test to do for mildly symptomatic or moderately symptomatic patients on day 1 and day 2. Having said that, a PCR and a CT test have a good relationship and an efficacy to diagnose COVID as high as 92.8%. So leave that to the clinician to tell you when you need to do a CT test.
Okay. And given, especially, I mean, I'm based in Delhi, and, given the issue with testing here, assuming that just no tests available, does one just consult a doctor and start meds? Should we wait? What's the right way to go about this?
So it's like saying you don't, in this whole genre of pandemicity of COVID-19, it's like telling someone, a lady, to wait for 9 months and deliver and then realize you were pregnant. So if you've got typical symptoms of COVID-19, I urge everyone to seek medical advice and start their therapy. Most often than not, 65 to 70% people just require rest, adequate hydration, and maybe some vitamins and paracetamol for fever. The other 20% may or 30% may require definite treatment. 10% require hospitalization, of which 5% require ICU. So yes, if you have symptoms, ask your doctor, and I'm sure he'll start treating you with it.
And same would apply even if I got a negative result. It could be a false negative, like you said. And if I believe I have symptoms, I could start meds. There's no downside to starting those meds.
There's no downside. You just need some monitoring to starting medication, but the medications are so mild. And if you get a negative report, my recommendation, if there's a high suspicion on the doctor, please retest yourself. You may want to test a second and a third time just to be 100% sure. And if your symptoms do persist, a very small sect of people will still have symptoms. That's a good time to get a CT scan.
Okay. Sorry, can we just mute lines, please? Yeah, thank you. Okay. So, the other thing is with medicines, right? I mean, my friend was given FabiFlu and ivermectin. I was not given. Should I have it, not have it? Are there standard protocols, given that a lot of docs now are just doing this remotely, right? So they don't actually see the patient. How does one go about this?
So mild to moderate infections require no treatment except tender love, care, vitamins, and paracetamol. They require nothing and isolation. That's the biggest treatment they require. Favipiravir is the only orally approved drug. This does not save lives. It shortens the duration of your suffering. If I say suffering, it means fever, cough, etc. So if your doctor feels deemed that you're right to take this Favipiravir, that's the only drug available. You must take it. Not one size fits all. So just because you've got COVID-19 doesn't mean everyone needs treatment.
Okay. The other thing is on timing of medicines, doc. I mean, what we hear is that, the first few days are very critical if you want to start medicines there. Should one generally wait for serious symptoms to develop and then start sort of proper so-called COVID medicines? Or is it better to just, go from the beginning?
So I would say that if you've really got a mild symptom in the beginning, you probably need no medications. I would not burden you with medications. But if you've got moderate symptoms right in the beginning, for example, high-grade fever, some cough, then I would start you. So in those circumstances, the earlier you start, the better it is.
So let's say one house, two of us have, are asymptomatic, two of us have got symptoms. The medicines could be different for each of us.
Yes, I'm going to be a little gender biased. Women, fortunately or unfortunately, do better than men. So even if you open your eyes and put your ears around, you'll actually find more people telling you, and there were more men suffering in the last 1 year than women suffering with COVID-19. So there could be a difference. Also, what I have noticed, that probably the first person who's got COVID in the family suffers the most, because he's got the highest viral load, and then it slows down. But age is the biggest risk factor for severe COVID. Age is a big risk factor. So the older you are, the higher the chance of getting a more severe infection. And next is obesity. And third is, of course, your diabetes, blood pressure, heart disease, cancer, etc., etc.
There was a question earlier from one of the older people about, should I also be having a flu shot or a pneumonia shot?
That's a very practical question. So a flu shot should be taken for everyone above 60 years of age. If you have diabetes, if you have a heart disease, if you've got COPD, if you've got asthma, or you're on immunosuppressants or some particular forms of drugs that decrease your immunity. Now, what is the timing of taking the flu shot compared to a COVID shot? So before you go in for a COVID shot, you must make sure that you've taken no other vaccine for 14 days. And this is simply because this is a new vaccine. We don't know how the COVID vaccine may interact with any other vaccine. So you should take a flu shot if you are eligible to take it. Space out your flu shot and the COVID vaccine by at least 15 days.
Okay. The other thing we're hearing of late is this, everything is fine for the first 12 days, and then somewhere in day 13, 14, things start to, deteriorate. And I've personally seen this in, sorry, we'll have to just mute. Roshita, your line is unmute if you can. Sorry, yeah. So sudden deterioration in conditions. I mean, is that something that's more common in this wave, and anything we can do to preempt this?
So the best thing that you asked me also before was, what do you keep at home besides all your vitamins? I should have told you actually then a pulse oximeter and a thermometer. Typically in this infection, it's between day 7 and day 11 where you can get worsening symptoms. So you may have fever, body ache, cough for first 2-3 days. And then you may be asymptomatic for the next 4 to 8 days. And then suddenly you realize you get high-grade fever, you get worsening cough, you get breathlessness, and your saturation drops. So it's not unheard of. So I tell every COVID patient, please be careful between day 7 and day 11. You may get worsening symptoms. A good parameter is the pulse oximeter. If you have a drop of 3 to 4% from your baseline, suppose your baseline is 96 or 97, and if you come down to 90, 91, that means your lungs are getting involved. The other thing you could do is take your pulse oximeter, walk for 6 minutes, and again take your oxygen saturation. If there is no drop of more than 3 to 4%, that means relatively you may be okay.
Okay. Somebody had asked a question about, if there are two of us at home who are, positive, isolate together, isolate separately, any?
Stay together, don't isolate separately. So all positives can mingle and jingle together.
Okay.
All suspects should be separate and all negatives should be separate. See, there could be a suspect. Suspect is when one family member has symptoms, but the test is negative. So he is a suspect. You could have 3 family members who have no symptoms, so they are negatives. And you have 2 people who've actually got positive reports, so they are positives.
Lot of questions, especially from people with comorbidities, right? So cough, cold, asthma, hypertension, etc. There, what precautions should we be taking? I mean, related around COVID, especially beyond that. Also, again, questions coming back on the jab. I mean, if I have diabetes, is it safe to take the jab, etc., etc. There.
Yes, I think I've answered that. It's safe for everyone to take the jab, unless you have a specific contraindication. If you feel you've got a contraindication, speak to your doctor. To me, there's no contraindication at this moment. I've told you those little contraindications, but that's so rare. So diabetic, heart disease, COPD, asthmatics, cancer patients, all are safe and all required to take the jab. What is your first part of the question, Mr. Agarwal?
Just about people with comorbidities. So if I've got bronchitis or allergies, asthma. Should I be, I mean, what do I need to do specially?
Yes, so those people should not go. Anyways, people should not go out, but they should certainly not go in crowded places. You should try to keep a distance as much as possible and keep wearing your mask because your lungs are already weakened and they're immunocompromised. One other thing is, please make sure you continue to take your medications prescribed to you before. Most people say that, doc, I've got already 15 pills and now you give me 10 more. How can I finish that? So I'll wait for those 15. No, you should have those pills together.
Okay. We're also hearing about different strains now. So should we be worried? I mean, at a layman level, should we be worried about this? I mean, different meds for different strains?
So there are no different medications for different strains. We should not be worried about it. I think what's caused this massive surge besides everything else is this variant strain B.1.117 and B.1.617 or whatever. So at this moment, both the vaccines are efficacious against these strains. So we are not worried. The one thing I would like to tell you about these strains is that these strains are actually not more severe, but they are more infectious. So they cause more infection. They don't cause more severity. So don't be scared that I've got a new strain, I'll get more.
Sorry, just wait a minute.
That's the other bug.
Sorry, Doc, are you back? We lost you.
Sorry. Can you hear me now?
Now we can, yeah.
Sorry. So the new variants, the vaccines are safe. New variants don't tell us the severity or don't worsen the severity. They are more infectious. So they increase infectivity.
Okay. Questions around proning. Is it genuinely an effective emergency measure?
So proning is excellent. It's not a preventive measure, but if you're suffering from COVID-19, proning is a good thing to do. It improves your lung capacity and improves your oxygen saturation. What does proning mean for those people who don't know? Proning is sleeping on your stomach.
Okay. Still continue to get questions, and I guess this also shows, where we are around the vaccine about pregnant women. Is it safe to take it, etc., etc. There. So
so pregnant women, yeah. No, that's a very good question, and I'll extend to lactating women also. So pregnant women, at this moment, the government of India and the ICMR has not given a mandate, but I can, feel the water of the ice, and I know we will get permission soon. I think pregnant women, data says that they can suffer from more severe COVID. My personal experience says that most pregnant women do very, very, very well. So there is a truth to say that pregnant women will be allowed to take the vaccine, and so is the truth for lactating women. In fact, they say that if you're lactating and if you're pregnant, you may pass on those antibodies maternally to your child. So I think it's only a couple of days or weeks away that you'll get a mandate to say pregnant women and lactating women should get vaccinated.
Okay. Just moving forward to sort of post-COVID, right? So I've had COVID, I'm on my, recovery. So lots of questions around what's the right time for me to leave? How do I know that I'm now not infectious? Do I need to sanitize the house, etc., all of that?
So if you, from the first day of symptom of COVID-19, not the test day or the result day, minimum 14 days isolation, quarantine, even if you're asymptomatic. I would say 17 days, but 14 days is okay. In my, the 10 days if you've been asymptomatic for the last 5 to 7 days, but I would stick to 14 at this moment. So once you're out of 14 days, if you have elderly people, I would still recommend you that you wear a mask at least at home for the next 4 to 5 days, specifically when you go to the elderly parents or grandparents or whoever. Sanitization, where we spoke about a possibility of fomite transmission. So it will be a good idea to sanitize the surfaces. You can call a professional sanitizer, or you can just use a simple disinfectant used for surfaces. Also, when you're isolated, it's a great thing not to use the air conditioner 24 hours. You must have some exchange of air, especially if you've got a central unit. You must have exchange of air. So it's a good idea to keep your windows open and get some fresh air. Please don't spit and snortle and use that tissue and trash it out of the window. Please, for heaven's sake.
And just to clarify, Doc, you said if I'm asymptomatic, quarantine is minimum 10 days, right?
I would stick to 14 days still. I would stick to 14 days. And what do you do? So do you do a repeat PCR test to know whether you're negative or no? No. I spoke about the PCR testing. It's a very specific test. It's so specific that it can pick up dead viruses also. So even after, so we've had severe COVID patients who've been in the ICU and required all sorts of managements. They may remain positive for up to 1 month and 2 months. So you do not need to do a repeat COVID test under any circumstances unless you're traveling, the government requires it, or there's a mandate for whatever reasons, but not to say that you're now not infective and free to move out.
Okay. And how long before I can get my strength back? When can I maybe start exercising, go to the gym? What's the recovery period? What are we seeing?
So it's like any other virus. If you've got a mild to moderate infection, and we're talking about people who are at home, I think it takes no more than 2 weeks until you start recovering. You should continue doing your breathing exercises, some pranayam when you're quarantined or isolated or sick at home. Thereafter, start walking on flat surfaces and start doing your regular exercise if you're an avid exerciser or a runner, at least after 2 weeks. Don't just start immediately. What we've also seen is 3 to 4 weeks post-COVID, I don't want people to get dehydrated because that, there's a coagulopathy. So your blood becomes a little thick. So I don't want you to get dehydrated. That can risk you getting a vascular episode. Whatever vascular episode means, I'm not scaring you with what that means, but just make sure you don't start running day after tomorrow if you're free today. Just build your thing slowly.
And while, of course, this is relatively a new virus, but what long-term effects on the body are we seeing from COVID?
Sorry, can you repeat that?
What I'm trying to understand is there science behind what medium to long-term effects of COVID are we seeing on?
So we are what I have seen and what I expect. The most common side effect, and this is not something to laugh or joke about, is mental side effect. You have fear, anxiety, mania, depression, insomnia, you don't sleep, but that's the easiest to maintain. And then for people who've had a severe morbid course, you get something called as post-traumatic stress disorder. And I'm using this because as organizations, if you do suffer from this, please seek guidance from a psychologist. It helps you tremendously, and there should be no fear in doing that. The other medical, truly medical, physical side effects, these include if you've got lung involvement, you may get some cough that can linger for 3 to 6 weeks. If you've had a bad disease, your cough may remain. A very few percentage of people may develop something called as fibrosis. The natural cause of fibrosis will only be a certain 2 years later, because 60% of them actually improve and come back to normalcy. 20% remain the same, they're stagnant, and 20% may worsen. So the good news is 80% of them may remain the same or improve, and 20%. But that's only for people who've got fibrosis, and not a large percentage of people develop fibrosis. A very small percentage develop fibrosis.
We seem to know of quite a few people who've had cardiac events a few weeks after COVID. I mean, is that just coincidental? Is there any data behind that?
No, Mr. Agarwal, this is what I was talking about, vascular events. So when I speak about vascular events, it means heart attacks, it means stroke. So it does happen. See, this virus makes your blood thicker. So when you have thickness, there is a chance that your blood can get clotted. So when you get clots, it can block the arteries or the veins, and you can thus get heart attacks or strokes. That's why we make sure you are well hydrated as much as you're allowed if you don't have any underlying disease that compels you not to take as much liquid, and go slow on exercises and not just go all out. Many people who will undergo tests when they have COVID-19 may be put on a blood thinner. And this blood thinner usually typically is continued for about 2 weeks after your COVID infection. This decreases the chance of these vascular episodes or heart attacks or acute strokes. However, even with an acute infection, you can get a heart attack and you can get a stroke. And that's also true for many other viral infections and other diseases.
One of the things, a lot of people said last year is, I get it once and I'm done and it's over. And of course, now we see, double COVID, and I haven't heard of a triple COVID as yet, but how likely is this to happen? I mean, how soon? What's the gap between the first time I get it and if I can get it again? Is it more fatal?
So of course, there's no triple COVID, but in a nonsensical way of saying, I've seen triple COVID in terms of saying COVID once, 2 vaccinations, and then COVID again. So that's like a triple COVID. So you can get COVID again. And typically it's after 3 months of getting your first illness, because for 3 months, your antibody response is pretty good. You usually don't get COVID. Very rarely you can get COVID again. So post 3 months, your immune antibodies drop and you can get COVID again. Does that mean that if you've got a severe COVID, you're free for life? No. Does that mean you'll get a more severe infection? By and large, the answer at this moment is no. But we don't know about these mutant strains as they emerge, because we will get new mutants. See, it's survival of the fittest. The virus is, so the bug is always stronger than the drugs, and that's why we have diseases and ICUs.
So they will mutate themselves later. And at that moment, we may be seeing a more severe infection. At this moment, we are not seeing a more severe infection when you get a second infection.
Okay. Two, three words that have come up now are concentrators, remdesivir. I mean, just specifically on oxygen, to go back, given it's so topical right now. Should we proactively just have a concentrator at home? Ideally, when is the right time? So if my oximeter is showing, let's say 93, 94, and my normal state has been, say, 97, should I be starting to think about oxygen? So just what's the view there?
Our country is undergoing a medical crisis, and I call this crisis not of healthcare, of the healthcare system, because the healthcare workers, the doctors and all are still working there. Is the healthcare of administration. It's the crisis of administration or not healthcare. Number one. Number two, we need oxygen. India makes about 7,500 metric tons of oxygen a day, and we require at this moment only 5,500 or 6,000 metric tons. So where's the other 1,000 going away? It's not going away anywhere. It's just not reaching the correct place. So my categorical answer to this is, do not hoard oxygen at home. Do not try to blackmail and save that remdesivir for a bad day. Imagine you are depriving someone who needs that drug, who needs that oxygen, just because you can afford it, to keep it with you. So please don't hoard it and keep it. If you've got a concentrator for whatever reason, and if your oxygen level goes below 92 or 91, then it's okay to start yourself on 1 liter of oxygen and monitor it. Please don't hoard oxygen cylinders and drugs like remdesivir. Please, it's a sincere request not to do that.
Okay. You mentioned that this is not a very severe strain, but yet, someone's talking about, we're seeing lots more lower oxygen levels this time around. Why is that happening?
So younger people are getting affected more. The reason is, one, vaccine hesitancy in the beginning for the elderly, so they didn't get vaccinated in time. Two, younger people are more asymptomatic, and thus with this new mutant strain, they're more infectious. Why are younger people getting affected more? So we are seeing younger people getting affected more and lungs getting involved much earlier. It's basically, if you have 2% or 5% of people getting into ICU, and if you have 1,000 people, you will have 50 people. But if you have 10,000 people, you will have 500 years, sound that more people are getting affected. If you see percentage wise, it may not be as bad. But yes, number wise, it is large. It's too big for this country to handle in terms of medical care, expertise, and hospitals.
Sure. Just to go back to oxygen again, Doc. I mean, so let's say I'm at home, my oxygen levels are falling. I just don't have access to either a cylinder or a hospital right now. What are some of the easy things I could do right now?
So of course, if your oxygen levels are dropping, you need to get a concentrator or cylinder. So you will have helpline numbers in and around your area. Someone will help you. You can ask one of your friends if they've got a concentrator. And I keep using the word concentrator because that actually builds in oxygen through electricity. It doesn't store oxygen like cylinders. Until then, if you still can't get it, you may want to go to the hospital immediately as early as possible. Other things that you can do is use a spirometer at home. A spirometer is a small device. It's like a balloon. You can start blowing balloons. Even if you have a mild COVID, that will enhance the vital capacity of your lung. Or you can buy this small plastic device called a spirometer, which people have seen. It's got 1 ball or 3 balls going in and out and blow into it. It improves your capacity.
Okay.
And prone position. Someone asked me about proning. That's a good idea.
Okay. And given, I mean, what we've always told is that 95 is a good number to track on the oximeter. Given where we are, I mean, would you say maybe 90? I don't know. What are the thoughts there?
So if you've got COPD, 95 may be superb for you. But if you're normal, athletic, young, 99 may be good for you. So any drop of 3 to 4% is you need to be cautious. That doesn't mean you run to the hospital. And that typically will happen between 7th and 11th day. More often than not, you should believe me that you will settle at home.
What's the telltale sign to say now this patient needs to get to a hospital?
Breathlessness, acute drop in oxygen, and worsening cough and fever. These are telltale signs. Of course, you have drowsiness, or if you're inundated, you have a drop in blood pressure. These are obvious signs. But these three are typical signs to say that you need to go into hospital.
Okay. A couple of people had asked about plasma, doc. So one is that there's a mixed views we're getting about whether plasma is useful at all for COVID treatment. So one, what's your thought on that? And two, the other flip side is I'm nervous about going into a hospital to donate plasma, etc. there. So just your thoughts on that.
So what is a vaccine and what is the role of plasma in COVID-19? So one way to get antibodies is by getting vaccines. When you are acutely sick with plasma, with COVID-19 and you're in the ICU, this is only required for severe COVID patients. It's plasma not to be used for mild and moderate COVID patients. One way to get antibodies, see if you vaccinate that person, then his antibody response will start after 15 days. So it's too late. So to get antibodies, you give plasma. Plasma is collected from a patient who suffered from COVID-19. So anyone who suffered from COVID-19, 15 days after your acute infection, is between the age of 18 and 60, is more than 50 kilograms of weight, is eligible to go and donate your plasma. I see no fear in donating your plasma. It's in one side or one corner or one station of the hospital. Wear your mask. That doesn't mean you just go COVID, scare free to say. But also remember my little telltale thing that I said, by and large, people who had COVID in the last 3 months do not get COVID again, by and large. So it's actually, you're probably the safest, even in the risky group, to go into the hospital. So these are the things. Should you use plasma? Studies have shown that plasma is not effective. I think it has a role in severe cases, but it's to be used very early in the disease. If you start developing antibodies on your own, then this plasma is of no use. So as doctors, we do an antibody test in a sick COVID patient. And if they don't have adequate antibodies and they are very, very sick early in the disease, especially first 3 to 5 days, that's the time we ask for plasma.
Okay. Just going back to the spirometer, you mentioned someone's asking whether can I do this as every day as a regular lung exercise? Is there any downside to that?
Singing, trumpet blowing, balloon blowing, spirometry, yoga, kapalbhati, any form of exercise is excellent for the lungs. Keep doing it. Do it yesterday, do it today, continue till tomorrow.
Okay. There's a broader question about saying that in the US, CDC has, of course, just announced about reduced mask usage. If I have to ask you to put on maybe your astrologer hat more than your doctor hat, I mean, when will India get there? Is it linked to immunization only or herd immunity?
at the pace this vaccine program is going. So there are two ways to achieve herd immunity. 60% of the population gets infected. That means 1 to 2% will die. Not get morbid, but will die. That's a colossal of a number. And the other is vaccination. So at the speed at which the vaccine program is going, I see more than 500 days for 60% of the population to get what we call as herd immunity. It's tremendously slow. It's at a snail's pace. So I think herd immunity is far away. The only way to go ahead is to get vaccinations, and India should speed up their vaccination program and hurry the vaccination program.
I guess that's a topic for a discussion for a whole, one more full session.
That's a policy topic.
Yeah. Okay. Again, questions coming back to taking the vaccine. So, menstrual cycle, can I take it? Any downside to that? menses has nothing. Do you not get an infection or get an infection when you have menses? Then why do you hesitate? Please, this is a WhatsApp group that's gone ahead and a forward, and don't believe in the dictionary or in anything that the WhatsApp says. It's absolutely safe. I'm sorry, I missed your question, Mr. Agar, about the CDC about masking down. So the US is hardly clocking any numbers of COVID-19 infections. Their vaccine efficacy is as high as 90-92%. There is little hesitancy there. They have more than 80 crores vaccines left, even after the entire eligible population of US gets vaccinated. And this will happen by 4th of July, the Independence Day, when President Biden has said that we want to inoculate the entire population. So they may say anything they want to say. We are far away from these numbers and far away from their reality. So we should wear our masks. Okay. I was looking at that talk by Dr. Devi Shetty. I'm sure you've probably seen it. And he was saying that it's likely that we are at 10x underreporting for different reasons there. And he was talking about the healthcare infrastructure, like you said, not the healthcare workers, but healthcare infrastructure. I mean, should we be genuinely worried? I mean, we're all worried right now, of course, because we're in the middle of a big peak, but should we be worried as regular citizens?
Yeah, we should be watchful. We should not be callous. We should not be careless. We should not be fearful at the same time. So we need to be worried. You don't want to get infected. You don't want your kids, kin, brother, sister, father, mother, friend, folk to get infected. So certainly we have to be watchful, but there's no reason actually to really get fearful. I keep telling everyone, we are more frightened than actually we are hurt, and we imagine more things for the worst than we actually go through it. So there's no real reason to say that we should be so scared, but it is not a pleasant situation. As far as numbers, it's also our problems as citizens that we get a little fever or cough or body ache for a day and we're okay. We don't go and self-test it. And if we come negative, we say, oh, we are negative. So as a family member or a friend, we must also advocate and advise our family member and friends that, listen, you've had a symptom, although you may be negative, please stay at home for at least 10 days, if not 14. Don't come out.
Okay. I don't know if this is a medical answer or not, but are we at our peak in India? Still a long way to go?
So I think, I know you're all parts from India. What I see in Mumbai is that I think you're peaking off. I see a nice, dramatic, I would say drastic change in the last 4 to 5 days. We peaked off. I can only fathom what is happening in Delhi, what will happen in UP, and what is, I think, in Bengal is just the tip of the iceberg. There must be underreporting, massive rallies. Kumbh Mela, the only entry and exit point, I'm sorry, Mr. Agarwal, I know you're from Delhi, is from Delhi. If I had to come to the Kumbh, I had to come through Delhi. So why should I not leave my footprints in Delhi, even if I have to go to Kumbh? So I think we are not away from the peak in terms of India. We may see a 500, 600,000. That's my guess and gut feeling. I am no astrologer, but I don't think we are peaking off. But Mumbai is doing well. My biggest fear is not about when will we peak and when will this settle, is when this vaccine drive starts. You will have 10,000, 5,000, 200, 300 people in capacities of 10, 100, and 1,000. gathering and conglomerating for this. And I've written, to everyone in Delhi and Maharashtra state, particularly I've spoken at a personal level, that you must make this completely safe and scrutinize every person coming into for a vaccine. Don't make sure that 100 people come in and then you say, you've got 100 appointments today, all 100 come in. What's worse is after you've taken the vaccine, if most people have taken a first shot, they would know that you're asked to wait for 15 to 20 minutes or 40 minutes in a waiting area. And that's when your guard comes down because you feel vaccine, ho gaya, now I'm safe. You want to drink water, you want to eat, you want to have that small free biscuit packet that is being given or the paracetamol that is being given, and your mask come down. And that's really scary. If that happens, I think we are not even done with this peak.
A lot of people are nervous, of course, putting the issues with the site aside, but people are nervous about getting a vaccine right now, just going into a hospital, etc. There, just any guidance on that?
Yes, so there are do's and don'ts, and my do's and don'ts for a vaccine is register yourself, reach on time. That means do register, do reach on time, do not reach much earlier than time, and of course don't go late. Do make sure that you have no flu-like symptoms. You've not had fever, cough, or body ache in the preceding 14 days. Make sure you don't have it. Even though you may be asymptomatic right now, you are not only at a risk for yourself, but you are going to spread that virus to this entire number of people sitting there. Once you're done with your vaccine in the waiting area, I just told you, do not get your mask down. Do not eat or drink anything until you leave that premises or sit in your car or vehicle or reach home. And you do not need to pre-medicate yourself with any medications. You must take your regular medications and go. And please go there and get yourself vaccinated. If you have COVID-appropriate behavior, COVIDian behavior, you are not going to get COVID-19.
Yeah, so Doc, we have been on a work from home for almost a year, but there are others on the call, it could be spouses who are going to office. So this is asking about, if I'm going into work, coming into contact with people, besides the obvious, mask up, etc. there, anything special I should be doing?
No, I think nothing. So if then everyone should get vaccinated, but you should be first in the line to get vaccinated to get some protection. Otherwise, there's nothing. The same thing that I told you, come home, wash your hands, throw your clothes for washing and sanitize your legs and feet, take a bath if it's possible, and then come out. Do not carry any external surface inside and put them on your table, desk, etc., etc. I'm not being paranoid and telling you sanitize your bag. You get an Amazon parcel, quarantine it for 5 days, then spray something on it. That's not done. Just clean your hands and that's good enough.
Okay. Doc, under how much pressure are healthcare workers right now? I mean, how bad is it?
It's terrible. It's almost virtually a thankless job. I know all of you are saying thank you very much, but in your hearts, it's a thankless job. Patients think it's a duty. Your father, your mother, your brother, your sister is not my duty to take care of them. This has happened because you have not behaved well. You are punishing us. We are under mental stress. We are under physical stress. We are under emotional stress. I think it's time that everyone unites together and prevents all this from happening. The healthcare system is at a debacle. It's at a disastrous state. There are no ICU beds. There are no normal beds. The sisters, the poor sisters have been working. You should see them working. They're in that PPE for 12 hours. Imagine you can't drink water. You can't go to the toilet. You can't eat. You can't talk on the phone to someone. And you're just taking care of someone who you don't even know or you're not even related to.
I'm just looking at a couple of questions more, and then I'm just conscious of time. We'll wrap up. There's questions about UV machines. A lot of people are buying them at home for sanitization. Any view on that?
So there has been studies to say that about 30 nm, whatever their metric is, it does help in sanitizing for 30 minutes. I don't think it's a bad idea.
Okay. Another question around post-vaccine. Should I be popping up paracetamol? Should I be waiting over there? What's any norms on that?
So if you have to get side effects, they're going to be mild fever, body ache, pain at the site of injection. And one more thing that I didn't tell you is when you go in for your injection, wear comfortable clothes. Don't wear tight-fitting clothes because you'll need to expose your left arm. So possibly wear a t-shirt or a sleeve that can uproll. So it's easier both for the vaccine giver and the vaccine taker. But otherwise, these are the things that you should do.
Okay. There's a question specifically about, if a small infant has got infected, right? I mean, how does that then work? If the mother is not infected, what do you do as a mom?
So the infant has obviously got infected because it's come in contact with someone. There's no case of maternal transmission. And if there is something called as maternal transmission, the mother has to be infected. So someone gone here and there has infected the infant. By and large, children do much, much better. They may get fever, cough and cold for about 3 to 5 days. The incidence of getting a severe infection or a complication of COVID-19 in children and infants is very low. It's not there, but it's very low.
Okay. And while on the topic of infants, the other question is on pets. Can I get this through my pet?
Technically, no. Again, it's like saying if my cook comes to eat and then if she sneezes and then you sniffle that food. So no.
Okay. And masking, the questions around if I'm open air where nobody's around me at all, or if I'm standing in my balcony in my house, do I still need to mask up?
No. If you're alone, if there's no one around you, you don't need to mask up. You're free to breathe that special quality of air that India has never seen over the last 100 years. Pollution free.
Yeah. A few things I want to just summarize, for you. So one, and there continue to be a lot of questions around vaccine. One, I'm hearing you say loud and clear, there are no side effects of the vaccine. In very, very few circumstances do you need to check with your doc, right? I mean, there's no downside to having the vaccine. There's only an upside to doing it, right? That's
where there are side effects that are predictable. The chance of severe side effects is very, very. For example, if you took the healthcare workers and you compared the 2 COVID vaccines, the incidence of getting an infection after 2 shots in 15 days was 0.04% in one and 0.03% in the other. That's virtually negligible. You're protecting 99+% more. So the side effects that we discussed are predictable. An odd patient can get a severe side effect, but that can happen with anyone. It's still safer than walking on the streets of Delhi and Mumbai and Bangalore and getting knocked down by a car.
That's true. Okay. So one is, get a vaccine. That's one. Sorry. The other was questions again around the gap. So between first dose and second dose, I heard you say 4 to 8 weeks, and it's fine even to do 4 weeks. Is that correct?
And my personal recommendation is 4 weeks is good for a COVID-naive patient specifically. When I say COVID-naive, means you've never suffered from COVID in the last 3 to 4 months.
Is that what it's called? COVID-naive?
So
okay.
Naive means someone who's raw, not infected.
Okay. And if I've had COVID, you said 2 weeks, right? Minimum.
Just 2 weeks before you take the jab. After you finish your COVID 15 days, 2 weeks at least, yes.
Okay. Got it. I think we are out of time, Doc. There are lots of specific questions which I have not asked you around, specific cases.
I saw G6PD, this, that. I saw some flashes, so it's safe for G6PDs. For all the Parsis and Lohanas and Kachis, you're safe to take it. That's where G6PD is more prominent.
Lovely. Great. Doc, this has been super useful. I mean, again, I know you said this is a thankless job, but from us at least, thank you for all that, you guys are doing. I mean, genuinely, you've been our superheroes, over the last 1 year. I mean, we cannot even imagine, I think, what you guys have been through, but that's also what we'll do is we'll later, once we talk to Doc, we'll share coordinates. If there are people who want to specifically do consultations, we'll arrange that, slightly later with Doc with his permission. So I'm not sharing any details right now. We'll check with him and then set that up later in case anyone's interested.
If you stay safe, you won't need us. So stay safe and don't come to us.
Lovely. Thank you. Thank you so much, Doc. Appreciate this.
All the best. Thank you.
Thank you.
Bye.
Thank you, sir.
Thank you.
Thank you so much.
Thank you, sir.
Thank you.
Thank you.